Good evening, everyone. It is a great honor for me to welcome one and all for the first Plastic and Reconstructive Surgery Conference cum live workshop to be held in Nagaland. Everyone asked me, even a few people who walked in today, why are you organizing a plastic surgery conference? What is the connection? How did you manage to do this plastic surgery conference? So I want to take this opportunity to answer this part of the question in the welcome address. I'm a surgical oncologist by profession. During my MCH training in Tata Memorial, Mumbai, I had the opportunity to work in the plastic reconstructive department for a period of 3 months during a rotation in my second year. I had the privilege to work with the head of the department then, Dr. Prabha Yadav Madam, Dr. Vinay Kansler, and most of all, Dr. Dushant Deswal sir, who is in our midst today, who has continued to be a mentor to me and a dear friend. There was something unique about the plastic surgery department and something unique that I experienced in the 3 months rotation that changed my entire outlook on patient care and surgical decision making. I was fascinated by how plastic surgeons were so pleasantly and distinctly different from oncosurgeons. Oncosurgeons were always high stress, sometimes hopelessly shuffling across the wards, operation theaters, sometimes clueless, sometimes we don't even know what case we are scrubbing up for, or retracting which part of the body. But amidst all this craziness in the hallways of Tata Memorial, plastic surgeons were definitely odd. They were unusually calm and composed. Their planning phase was long, quite long. Sometimes it felt longer than the actual reconstruction phase. Just an exaggeration. Plastic surgeons were never in a hurry. They never made uncalculated cuts. Every step was carefully discussed, and every step was intentional. I never met surgeons who valued tissue, the living tissue, more than plastic surgeons. They were always very focused and not distracted. They had a backup plan for everything. They had a backup plan for a backup plan. So there were 3 plans already ready in place before they started cutting the skin. They could morph their plans to any defect that a surgical oncologist will create. Name the size, the shape, the dimension, the depth, or the tissue involved. Rain or shine, they had a plan. So that's how we have come here, and that brings us to the very well-known 10 Commandments by Gillies Millard back in 1950 of plastic surgery, which Dr. Dushant introduced to me when I was working with him as a resident. Commandment 1 was, thou shalt have a plan. That sounds very simple, and yet so much depth and wisdom in that one word, plan. One other commandment that affected my practice till date today is commandment number 8. Thou shalt not do today what thou canst put off till tomorrow. Isn't that the procrastination my mother, who's sitting here, told me not to do? Isn't that defying all other surgical principles of act and explore immediately? But the plastic surgeon said, wait, wait, wait. It's not time yet. Thou shalt not throw away any living thing. It is when time stood still, I, as a resident, learned to understand the wisdom behind the waiting before the act. This experience was truly a game changer for me, which till this day helps me make that one decision which will make all the difference. As an oncosurgeon, we think we are brave, but working in a team with plastic surgeons makes us even more brave what we actually think we are. Oncosurgeons are notorious for creating large defects, moving any part of the body that we want to remove, where cosmesis is secondary. We want wide margins. We need to go so wide at times that our hands are tied. How can I cut this tissue if I cannot close the wound? How can I cut this tissue if the organ can no longer serve any useful purpose? Plastic surgeon's presence in our lives makes us remove the tumor with peace and contentment, perhaps even increase our rates of R0 resection. Working as a lone surgical oncologist, nearly 10 years here in Kohima now, doing my own reconstruction work, I have missed the plastic surgeons dearly. The experience has made me realize what an empowering specialty plastic and reconstructive surgery is. I looked for them far and wide. I tried to connect with some from the neighboring state, but only found a few. So few. Why can't we have more plastic surgeons? I meet a lot of young surgeons and I ask them the question, what super specialty do you want to take? And the usual flow of choices would be Uro, GI, pediatric, neuro. I hardly come across surgeons who want to be plastic surgeons, and I used to wonder why. Is there some serious misconception about the specialty in our training programs in the undergrad years or masters? Or perhaps it's ignorance about the scopes and the possibilities. The demand and the need is huge, but their takers seems to be very few, at least in our region. So this is back to the question that we're answering today. Why are we organizing a plastic surgery conference? Because I'm very much a plastic surgeon at heart, as much as I'm an oncosurgeon. The principles of reconstructive surgery are omnipresent across all other specialties, and we shouldn't keep it a secret. Hence, the sole purpose of this conference is to invite experts in the fields from Mumbai, from Manipur, Sikkim, Meghalaya, who are torchbearers in this region, and they are here to enlighten us today about the scopes of this specialty. Through this conference, we envision that all our patients, up to the remotest villages of Nagaland, will experience the little change in our thought process, the little change in our incisions, and the little change in our day-to-day treatment planning and care. With this, on behalf of the organizing committee of Putuonuo Hospital, Kohima, in collaboration with the Plastic Surgery Foundation and the Association of Surgeons of Nagaland, I extend a warm welcome to all the faculty, delegates, their family members, and special invitees, especially those who are coming to Nagaland for the first time, and all the volunteers here. A warm welcome to this conference. Thank you.